Hi, this is my microbiology presentation on fibrosis, salmonellosis, and bubonic plague. Fibrosis is a pathological condition characterized by excessive accumulation of fibrous connective tissues in an organ. It can affect many organs like the liver, lungs, heart, and kidneys, and among others. The causative agent and background depends on the specific organ of the disease. So, liver fibrosis is caused by hepatitis B, C, alcohol abuse, and non alcoholic fatty liver disease, as well as autoimmune hepatitis. The pulmonary fibrosis, which is the lungs, are affected by exposure to environmental toxins, occupational hazards, and autoimmune diseases. Cardiac fibrosis are caused by conditions such as hypertension, myocardial infarction, valvular heart disease, and chronic heart failure. Renal fibrosis is the kidneys and can be caused by chronic kidney diseases, hypertension, and even genetic disorders. Fibrosis is a complex pathological process that involves multiple factors like inflammation, tissue injury, dysregulated wound healing, and specific causative agents depending on the organ. The mechanisms of fibrosis involves a complex interplay of cellular and molecular processes that result in the excessive accumulation of the fibrous tissue, mainly collagen. While the specific mechanism can depend on the organ, here are a few in the process: tissue injury, inflammatory response, activation of fibroblasts, excessive extracellular matrix deposition, myofibroblast differentiation, ECM remodeling and cross-linking, loss of normal tissue articulture and function, feedback loop, and chronic fibrosis. The mechanisms of fibrosis, again, involves a complex cascade of cellular and molecular events that result in the dysregulated repair and remodeling of the following injury or insult. The symptoms someone may experience during fibrosis can depend on the specific organ, of course, but most of them or most of the main symptoms are shortness of breath, persistent cough, fatigue, chest pain or tightness, wheezing, clubbing of fingers, which is when they swell and become enlarged and round due to low oxygen in the blood, dry, cracking skin, joint pain, edema, and symptoms of organ dysfunction. So if it's the liver, then the liver begins to shut down, and you have, symptoms from that. It is important to note that the symptoms may start slow and nonspecific. So it's important to get early detection and treatment to slow the progression of fibrosis and improve quality of life. To diagnose fibrosis, it typically involves a combination of images, tests, and procedures. Medical history and physical examination is one. Imaging studies like x-rays, ultrasound, CT scans, MRIs. Pulmonary function tests for the lungs. Laboratory tests like liver function tests, autoantibody testing, and serological markers can help detect fibrosis. Biopsies of a specific organ, so the lungs, the liver, the skin can be biopsied and sent off to see if there are suspected site of the fibrosis. And genetic testing in some cases, like cystic fibrosis, is hereditary, and you can identify the specific gene mutations associated with that condition. The diagnostic approach may sometimes be very comprehensive, where you need multiple specialists involved to evaluate and manage. The epidemiology of fibrosis is essential in identifying at-risk populations, implementing preventive measures, and developing targeted interventions to improve outcomes for affected individuals. Here are a few of the epidemiology of the different fibrosis. Pulmonary fibrosis is most common in between people that are 50 to 70 years old. It is increasing with higher rates reported in industrialized countries, and the risk factors are smoking, environmental exposures, genetics, and certain underlying conditions. Liver fibrosis encompasses a spectrum of liver diseases characterized by the progressive accumulation of scar tissue. Again, it's caused by hepatitis, alcohol abuse, non-alcoholic fatty liver disease, and autoimmune diseases. The prevalence of liver fibrosis varies geographically and is influenced by the alcohol, hepatitis, and obesity. Cardiac fibrosis is a common pathological feature of various cardiovascular diseases like hypertension, valvular heart disease, and heart failure. The prevalence of cardiac fibrosis increases with age, and the risk factors are hypertension, diabetes, and obesity. Um, Cardiac fibrosis contributes to myocardial stiffness, impaired contractility, arrhythmias, and leading to the heart failure and other cardiovascular complications. Renal fibrosis is a common feature of chronic kidney disease and is associated with progressive loss of kidney function. Renal fibrosis is the leading cause of end-stage renal disease and associated with the increased morbidity and mortality. The treatment of fibrosis varies depending on the underlying cause, of course, and the tissue or the organ, and the severity. But here are a few of the different medications that a professional can prescribe: steroids, immunosuppressants, antibiotics as well. Oxygen therapy is also a treatment or a therapy for fibrosis, especially pulmonary fibrosis. Pulmonary rehabilitation um, is one. Lifestyle modifications is a big one. Quit smoking, change what you're eating, weight management, and exercise. Management of underlying conditions. So if it's hepatitis, if it's hypertension, diabetes, you want to treat those in order to treat the fibrosis. Surgical interventions, sometimes organ transplant are needed, and experimental therapies are still being studied today, like gene therapy, cell-based therapies, and more. It's important for individuals with fibrosis to work closely with healthcare providers, including specialists as pulmonologists, hepatologists, rheumatologists, and nephrologists, and develop an individualized treatment plan tailored to their specific needs. Early diagnosis and ongoing monitoring are essential for optimizing outcomes and improving quality of life for individuals with fibrosis. Now, moving forward into salmonellosis. Salmonellosis is an infection disease caused by the bacteria of the genus Salmonella. It is one of the most common foodborne illnesses in the world. It starts as an inflammatory infection in the gastrointestines, and it's transmitted through contaminated foods such as poultry, eggs, meat, and unpasteurized dairy products. It can also be transmitted through contaminated water and person to person or through an animal in its environment. Again, the causative agent is Salmonella enterica. Within that species, there are numerous serotypes with distinct and antigenic properties. The mechanisms of salmonellosis are listed here: ingestion of the contaminated water or food, survival through the stomach acid, adhesions and invasion, inflammatory response, multiplication and spread, immune response, and then the symptoms like the diarrhea, abdominal cramps, fever, nausea, and vomiting. Overall, the disease mechanisms of salmonellosis involves a complex interplay between the bacteria, the host immune system, and the inflammatory response, leading to gastrointestinal symptoms and potential systemic complications. Patients with salmonellosis can experience a range of symptoms, which can vary in severity. So listed here are a few of the symptoms: diarrhea, abdominal cramps, fever, nausea and vomiting, headache, muscle pain, and fatigue. Severity and duration of these symptoms can vary from person to person, particularly in vulnerable populations such as children, elderly, and weakened immune systems. Salmonellosis can lead to more severe complications like dehydration, bacteria in the blood, and or infections of other organs. In some instances, symptoms suggest of salmonellosis, especially if they are severe or persistent, and it's important to seek medical attention. In diagnosing salmonellosis, it typically involves a combination of clinical evaluation, tests, and images. So, in clinical evaluation with a healthcare provider is one. Stool cultures is one of the main ones. They can test for the actual bacteria in the stool. Stool antigen testing, so they can also test for the antigens in your stool for that specific bacteria. Blood cultures, if there is expected to be any salmonella in your blood, then they can test for that as well. Imaging, so you can do CT scans, X-rays of your gastrointestinal tract to kind of see if there's any abscesses or any abnormalities there. And then serological testing, such as enzyme link, immunosorbent assays can be used to detect antibodies against salmonella in the patient's blood. Treatment and management of salmonellosis will depend on the severity of the illness, the presence of the complications, and other factors. But if you are experiencing any of these, again, it is important to speak with a medical professional. Understanding that epidemiology of salmonellosis is essential for the guiding public health interventions aimed to preventing and controlling the spread of the disease, reducing its impact on affected individuals and communities, and improving food safety practices. Here are a few of the epidemiology that I found on salmonellosis. Global burden. So it's affecting worldwide. Transmission routes. It can be transmitted through various routes, such as contaminated food, water, and infected from person to person. Seasonal. So it's more prevalent for this bacteria to grow during warmer months and versus colder months. Vulnerability populations. Certain populations have an increased risk, such as young children, elderly people, pregnant women, and people with weakened immune systems. Foodborne outbreaks. Salmonellosis outbreaks are frequently linked to consumptions of contaminated food items such as fresh produce, eggs, poultry, and dairy products. Foodborne outbreaks may involve multiple cases tracked back to a common source of contamination and can occur in various settings like households, restaurants, and even food processing facilities. Surveillance and reporting. Public health authorities use surveillance systems to monitor and track cases of salmonellosis. Surveillance data provide valuable information about the disease trends, geographic distribution, risk factors, and source of infection. Prevention strategies. Prevention of salmonellosis involves implementing various measures to reduce the risk of contamination and transmission. These strategies include promoting safe food handling practices, ensuring proper hygiene and sanitation, implementing food safety regulations and inspections, and educating the public about the importance of food safety. The treatment of salmonellosis depends on the severity, of course, and the illness, whether complications are present or not. In many cases, especially for uncomplicated salmonellosis, supportive care and self-management strategies may be sufficient. However, in severe cases, there are medical interventions like fluid and electrolyte replacement. So diarrhea and vomiting can cause you to become dehydrated. So replacing those electrolytes and fluid can help. Antibiotics. So depending on, in some cases, antibiotics may be prescribed to shorten the duration of the illness, reduce the severity of symptoms, and more. Anti-diarrheal medication. So, a symptom is diarrhea. So there are medications that can stop that and slow down the motility of the intestine. Fever and pain management. Over-the-counter medications like ibuprofen, Tylenol can reduce fever and alleviate pain or discomfort. And then rest and self-care. Getting plenty of rest and maintaining good hygiene practices such as frequent hand washing and can help support the body's recovery and prevent the spread of the infection. Individuals with severe or persistent symptoms such as those with higher risk and complications should seek medical attention promptly. Additionally, antibiotic treatment should only be initiated by healthcare professionals. And you would need to be managed by that and make sure that it is completely resolved before stopping those. All right, bubonic plague. Bubonic plague causative agent is a bacteria called Yersinia pestis. Yersinia pestis was first identified and associated during an outbreak of plague in Hong Kong in 1894 by the French-Swiss bacteriologist Alexandre Yersinia and the Japanese bacteriologist Shibashiro Katasto. Bubonic plague is a severe, often fatal bacterial infection caused by Yersinia pestis. It's one of the main three forms of the plague. You have pneumonic plague and septicemic plague. The bubonic plague is primarily transmitted through the bite of infected fleas, which typically infest rodents such as rats. Humans become infected when they are bitten by the fleas who fed on the infected animals. Um, Bubonic plague has been responsible for several pandemics throughout history, including the infamous Black Death pandemic in the 14th century, which resulted in millions of deaths in Europe, Asia, and Africa. Um, while today bubonic plague still occurs in various parts of the world, particularly in regions where rodents and fleas are prevalent, early diagnosis, prompt treatment, and public health measures are essential for controlling outbreaks. The disease mechanisms of bubonic plague involve a complex interplay between the bacteria and the host immune response. So, introduction of the bacteria. The bubonic plague typically begins when the bacteria is introduced to the host through a bite of the flea. Localized infection of lymph nodes. So, the lymph nodes are affected um, once you are bitten at that localized spot. Formation of buboes. In bubonic plague, the most characteristic feature in the formation of swollen and painful lymph nodes, which we call buboes. Buboes are caused by the accumulation of immune cells, inflammatory mediators, and the bacteria within the lymph nodes. Immune evasion strategies. So the bacteria employs various strategies to evade and subvert the host immune response, allowing it to persist and replicate within the host. Systemic spread and complications. In some cases, Yersinia pestis can disseminate from the lymph nodes and other organs and tissues, leading to systemic infection and potentially life-threatening complications. And then the host immune response. The host immune response to the bacteria involves both innate and adaptive immune mechanisms. The innate immune cells, such as macrophages, neutrophils, and dendritic cells, recognize and respond to the presence of the bacteria, initiating inflammatory responses and recruiting additional immune cells to the site of the infection. Adaptive immune responses, including the production of antibodies and activation of T cells, also play a role in controlling and clearing the infection. The bubonic plague operates through complex processes within the human body. Again, it starts with entry, usually through the flea bite, and then it replicates and it spreads to the lymphatic system. The progression results in developing of the buboes, enlarged and tender lymph nodes, which are the key symptoms of the disease. The bacterial virulence factors are essential for the ability to cause disease. Symptoms. Symptoms can vary in severity. Most of them are sudden onset of fever, chills and body aches, painful swollen lymph nodes, skin lesions, headaches, and nausea and vomiting. The symptoms of bubonic plague can develop rapidly within a few days of exposure to the bacteria. If left untreated, bubonic plague can progress to more serious forms of the disease, like pneumonic plague and systemic plague, which carry a high risk for mortality. Therefore, it's very important to get medical attention if you think you're experiencing bubonic plague. The epidemiology of bubonic plague has evolved over centuries. Um, Bubonic plague has left an remarkable mark on human history, notably through devastating pandemics like the Black Death in the 14th century, which claimed millions of lives across Europe, Asia, and North Africa. Other significant outbreaks, such as the Justine plague in the 6th century and the third pandemic in the late 19th and early 20th century, have further underscored the severity of the disease. Today, bubonic plague persists in an endemic threat in the specific regions worldwide, particularly in rural areas of Africa, Asia, and the Americas, including Madagascar, DR of the Congo, Peru, and Central Asia. This disease primarily affects animals, with rodents serving as the primary reservoir and transmission to humans typically occurring through the bite. Often found on rodents like rats. Bubonic plague outbreaks often exhibit seasonal patterns, again in warmer months, influenced by factors like climate, agriculture practice, and rodent populations, with increased incidence during certain times of the year. Human cases arise not only from close contact with the combat with the infected animal or their fleas, but also from travel-related exposures to endemic regions or areas experience outbreaks. Efforts to combat bubonic plague encompass rigorous public health measures, including surveillance of rodent populations, vector control, um, insecticides, and rodent management and vaccinations of high-risk populations. Early detection and treatment are paramount, highlighting the importance of coordinated efforts at local, national, and international levels to effectively manage this ongoing threat and minimize the impact on global health. The treatment and therapy for bubonic plague involve prompt administration of antibiotics, supportive care, and public health measures. So, antibiotic therapy are some antibiotics are prescribed, supportive care, vector control, and public health measures, vaccinations. Treatment and management of bubonic plague require multiple different healthcare providers, public health authorities, and community stakeholders. Early detection, prompt antibiotic treatment, and implementation of public health interventions are essential for controlling outbreaks, reducing transmission, and preventing complications associated with bubonic plague. Thank you so much for listening to my presentation. I hope that you got all the information that you needed. Here is my site page for all three of the diseases. And I also want to thank my professor, Mr. Scott Britton, for giving us a little bit of extra time to get this done. And I apologize for my voice. I'm a little sick, and for my I can never say words right. So mispronunciation of some of the words. I apologize for that, but thank you again and have a good one.